All right, I think we're live.
It's Robin and Kim here for our Wellness Wednesday Health Chat. And today we're going to be talking about oral cancer. We have an expert with us, and Kim is going to introduce her. So take it away, Kim.
Yes, I'm super excited to introduce Eva Grayzel, who I met her on Instagram, found her on Instagram. I know that's another story. And I reached out to her because I've had two people that I know. One I know for sure, and I didn't know it was a related family, a father and a son, who both had neck cancer. So that was on my radar because it was heartbreaking. So anyway, when I found Eva, I thought, oh, I need to talk with her about this and listen to her story, which I think is really interesting. So, and Eva is coming to us from Florida. So she's in sunny Florida and she looks sunny herself. So we're excited to have you here, Eva.
Thanks, Kim. What makes me an expert is that I'm a survivor of 28 years now. And there were a lot of things that I could have, I should have never been diagnosed at stage 4. Let's start with
Mhm.
that. So let
Okay.
me tell you why that happened. Why I progressed to stage 4 when I was 31 years old. I first presented with some symptoms. I had a sore in my tongue that didn't heal.
Mm,
I went to a doctor. They said, you never smoke, you're young, it's irritation. And for 9 months after that, I was treated for trauma. They shaved my teeth down, they gave me gels and rinses. One doctor told me I talk too much. Yeah, but yes. Can you believe it?
What the heck?
I was dismissed
Yeah.
because I didn't fit the profile of someone who gets oral cancer. People think it's for people who are old and smoke and typically men. Well, hello, I was 33 when I was finally diagnosed. And I want to tell you what I've learned over all these years. Number one, you should be getting an oral cancer screening at every dental checkup. What is it? They yank your tongue out, they
Mhm.
look for lumps, bumps, irregularities. They actually feel inside your mouth for irregularities and they look. They should also be feeling your neck, palpating your neck, and looking at the back of your throat for asymmetry. In
mm,
other words, if one of your tonsils is a little larger or redder than the other, that's a sign.
Hmm.
And when you have something like that, you don't go to an oral surgeon, you want to go to an ENT, an ear, nose, and throat doctor. They are experts at the oropharynx, at the back of the throat. They'll probably do a scope and look in there. You want to make sure you rule out cancer. Once you do that, then they could treat you for whatever they think it might be. I had an unhealing sore right here on the lateral border of my tongue. I did have a biopsy early on, but unfortunately for me, it was misread.
Mm.
Why? It went to a general pathologist who reads all kinds of tissues and missed the subtle changes that an oral pathologist may have noticed.
Mm.
So these oral pathologists have 3 additional years in studying particularly tissue of the mouth. So unfortunately for me, I never even knew they existed.
Wow.
wow.
I would have, when I continued with symptoms, I would have sent my pathology to an oral pathologist, but I didn't know.
Hmm.
Wow. That's
That's,
amazing.
I'm so glad to hear you say it because I have been sent a couple times to an ENT for a couple things under my tongue. Well, actually, they both were underneath. So my dentist has done a good job. Thank God.
Referring you,
Yeah.
it's so
Yeah.
important to
Yeah.
refer. And then if you go to a specialist, Robin, who doesn't make you feel like they've got it right, like
Right.
intuitively you feel, I'm not sure they're right, you need a second opinion. You got to rule out cancer and then go, you. So I always recommend to go to the big city near you to a major dental school.
Yeah.
In the dental school,
Mhm.
they typically have a clinic. That would be a great place to get people who are in they know the latest and greatest in the
Fresh.
field.
Yeah.
Yes, and they can inform you who to go to or the direction to take.
Yeah.
Wow.
That's
That's good
good
to know.
advice. Yeah. Good advice.
Do either of you get an oral cancer screening when you go to your dentist?
I
I
mean,
don't think so.
mine always pulls my tongue out and turns it and looks, and he does the inside of the mouth thing. So
Does he
now
palpate your
he
neck?
doesn't always do my neck. I don't think so, but all the other
Okay,
internal,
so
yeah.
the most common sign of oropharyngeal cancer, which people say is neck cancer, but it's actually base of tongue cancer,
Hmm.
the sign is a hard, fixed lymph node in the neck.
Hmm.
Now, if you've got a lymph node that sort of moves around and it's tender, it's probably doing its job. But if it's hard and fixed, you need
Yeah.
to get to an
Get it
ENT.
checked. Yeah.
So that's
Wow.
why it's so important for them to feel your neck. And what happens is a lot of men in the ages of 35 to 55 notice something in their neck, but they think it's a hair follicle or they
Mm,
think it's nothing to worry about because it doesn't hurt them. But actually, those are the serious ones.
wow.
Wow.
That's
I
good
was
to
just
know.
yeah, I was just reminded of the boy I went to senior prom with in high school. He, when we were like 25 and 26, he got tongue cancer and he passed away. I'd forgotten that. And that's so young. And that
Yeah.
was back in the 1980s. So isn't that crazy that like that was, I
So
had
that was
always,
oral cavity cancer. And now the most prevalent type of oral cancer is oropharynx cancer. It's a
mm,
lot more common now because
okay.
smoking is declining. So
Hmm.
there's fewer oral cavity cancers. Even though I was never a smoker,
Yeah, yeah.
you
Right.
can still get oral cavity
Mhm.
cancer. But now more prevalent is this oropharynx cancer. And it's due to the HPV virus
Okay.
primarily, but not always. Maybe 70% of base of tongue cancers are HPV.
Okay.
And I
Mm,
know you've asked about HPV. It's tricky because 80% of us are positive for HPV. So
Wow.
most of us have no idea we even have it, and it's a
Mhm.
virus that we just shed. So we have no idea if we're positive at the time and maybe passing it on to someone else. So somebody in their 40s might get base of tongue cancer, and they may have actually picked up the virus when they were in high school.
mm,
And it lay dormant for many, many years. And that's what this virus does. And
Wow.
then a stressful incident happens or a period
Mhm.
of time where their immune system is low and this virus is a little more active. And then it can progress.
Wow.
okay.
That's
So we
crazy.
don't know a lot about HPV,
Yeah.
but that's why it's so important to be feeling your own neck. In fact,
Yeah.
right now, Robin and Kim,
Yeah.
turn your chin to one shoulder and you see how that muscle pops out?
Yeah.
Grab the muscle and go all the way down on both sides. Now watch what happens when you put your chin down to your shoulder. Do you see how it pops in a
Yeah.
different way? You can get in there in a different way.
Yeah. Oh,
That's
wow.
what your
Hmm.
dentist or hygienist should be doing. But
Wow.
if for
That's
all of your listeners who don't go to a dentist, you could be doing a self exam. You could be
Go to the
feeling your
dentist,
own
first
neck.
of all.
You
Go to the
could be
dentist, though.
looking,
Yeah.
in your own mouth. Flip your lips. When your fingernails are short and clean in the shower, palpate your tongue, feel what's normal in your mouth.
wow.
Notice the bumps that might be on your palate because one day you might be feeling around and say, "Ooh, I never
Right.
felt that before." And
Right.
it's the things that don't hurt, which are early stage.
Mm,
Mm,
Once they begin to hurt, you're developing into a later stage.
wow.
If it's cancer. So it's good. Like we do breast exams. We know how to do skin exams.
right.
We're in our mouths twice a day brushing. So
Right.
when you brush, just take a peek, look in your mouth, get to know what's normal so that when something develops, you know to get into a specialist, a dentist,
Yeah.
or a referral to a specialist.
When
I
you
should have.
had your, Oh, sorry. Go
Sorry, I
ahead.
should have looked this up, but how common is oral cancer? Like, do you know a statistic or
Yes, 60,000 people
okay,
die of oral cancer every year.
wow.
So it's not a huge
But
number,
it's
but if
still,
you're one in the 60,000, it's big.
yeah, yeah, yeah. Sorry, Kim.
Wow. No, when you had the bump on your tongue, did it advance to hurting, or was
Right.
it
So at first, it was the texture was different in that area. It didn't hurt.
okay?
And then the color was a little lighter. It wasn't a normal color. Color and texture are two things to look for.
Okay.
Then it progressed to an ulcer, a sore,
Mm,
and the sore was painful.
hmm.
It felt like a canker sore, but
Mm,
it didn't heal.
Yeah,
Anything anywhere in your body should actually heal within a couple weeks, but
sure.
right.
especially in your mouth heals very quickly. If
Mhm.
an ulcer doesn't heal in your mouth in 2 weeks, it needs to be evaluated.
That's,
Yeah,
I read that like people if they feel something or see something and it doesn't heal like in 2 weeks because a lot of people think it will heal, but if it doesn't, that is a great thing to be
Be
aware of.
aware of.
Yeah,
Yes.
for sure. Thank you for sharing that. Wow. Wow, that was a lot in a
Yeah.
short amount of time. I
now
love that.
I have a question. Kim found you on Instagram, but this is because you do things to bring awareness, right? Am I understanding this
Well, I
correctly?
do, but I also love to dance. So, Robin, I used to worry about what people thought when I was out there dancing the way I like to dance. And after surviving cancer, I stopped worrying about what people think because who knew how long my life was? I am out to have fun. And when
Yep.
I hear live music, I just, I, my whole body lights up. All I want to do is dance. And I don't care what people think. Some people aren't so nice. They
Yeah,
have all
well.
kinds of names and
Oh,
they
jeez.
but that's okay. They don't know my story. And when they do, maybe they're a little more empathetic. But
Right.
yeah, so Kim saw me out there dancing and I
Like,
videotape myself dancing mostly because people who watch me dance can feel my joy. They can feel
yeah,
that I've got a backstory. And
Yeah.
afterwards, there are people who actually ask me, you know, what is your backstory? Because I know
Yeah.
you've got one.
Yeah.
that's
That's
neat.
awesome. Yeah.
Yeah, and a lot of positive energy too. That's you bring that as well, I think, and that's neat. And yeah, I love watching you dance. I'm a Zumba instructor. I love to dance and teach, dance classes in that way. But yeah, I love how you freeform and just you nail the music. I love that.
Listen, if more people danced, the world would be a better place.
Oh
I
my
think
goodness,
We'd
so.
all be a lot happier. That's for
for
sure.
sure, for sure.
Yeah.
And people can find you on Instagram. Are you Eva Grayzel on
Yep.
Instagram?
Eva
Okay,
Gray,
yeah,
Grayzel.
beautiful,
And you
beautiful.
can learn more about oral cancer at sixstepscreening.org.
Ooh, we'll
Okay.
put that
We'll
in.
So
put
that's
both
my
of those things
advocacy
in the
work.
comments.
And for all of your listeners who have dentists,
Yeah.
bring them a poster. You can print posters up and bring it in to your dental practice and make sure that your dentist is educating patients. Because if your dental practice isn't educating patients, then nobody is.
Yeah.
That's
That's
interesting.
right.
And you're on a special panel tonight, I know, teaching dentists, talking to dentists, correct?
I am. So this is a
Yeah.
live, and if you're interested in hearing my presentation tonight, it's good storytelling. It's my story, and I'm telling it for Crest Oral B. Dental professionals can get free continuing education credits, and
Oh,
we can
Link
leave
it.
the link down below in the notes.
oh yeah,
Okay,
we'll do
good.
that. Yeah,
Good.
yeah, yeah. Thank you for that. Wow. You've been a wealth of information. Thank you
Yeah, it's
so much.
great.
Because you brought a lot of awareness to me that I didn't know as well. So my
Listen, Kim
next,
and Robin, I do this as an obligation to all
mm,
those who came before me, who
Yeah.
made my outcome so good. And I do this for all the people who are going to come after me.
Yeah.
wow. Yeah.
It's more than
Well,
a mission, it's really an obligation.
Well,
wow.
that's awesome. That's
That's a
awesome.
great way to
So
look at
thank you
it.
for hosting me on your program today.
Yep.
Yeah.
Yep.
And if any of your listeners have questions, I'll leave my email below so they can reach out.
That's
Love
awesome.
that. Oh, thank you so much.
Thank
Thank you
you.
so
And it
much,
was
Eva.
so good to meet you.
Yeah.
Thanks.
And
All
I just
right.
want to thank you, Eva, for joining us. And I hope you enjoyed this episode. And I just want to say have fun and live young, and we'll see you next week. All right. Bye-bye.
Bye.
Yeah. Bye.